And we demand, Americans demand the very best. I mean, and these things are expensive, they'll be more expensive. You know, for every $1 spent on a newer pharmaceutical, we're saving $7.17 in hospital costs. There are a lot of wonderful new drugs and biologics that have been developed that you know, they are expensive, but they reduce long-term costs. So.
Well, but all this stuff gets back to, or my question with this is that the reason everything costs so much is we aren't paying the bills, and so we don't pay, the end consumer doesn't pay the bills.
Right.
We don't care what it costs, we're incentivized to get the benefit. We paid the insurance premiums, I want the free stuff now.
Right.
So my question is, how do you change that model? I mean, if a free marketplace is going to work, you've got to get the buy-in from the American consumer and change that, get to critical mass to do that. How do you do that?
Well, you know, I mean, you're absolutely right. That's why I talk about people have first dollar coverage. They don't know what it costs, and they demand a lot more of it. They, you know, that's why I support patient-centered solutions, because doctors and patients should be making decisions about whether you need a stent or you don't. You don't want, you know, some bureaucrat at this federal coordinating council saying that your mother cannot get treatment because she's X years old. But we need to put patients and doctors and families back into...
But the only way to do that is by paying the bills.
Right, exactly, and you're exactly right. And we need an educational program, because the American people have become so used to, because as I said, during World War II, when the government said, we're going to give you, the employer, a benefit, and you, the employee, gets your health care tax-free. So people have, you know, that's in the 40s, people don't know any different. We need a huge educational program, and that's what people have been trying to do with health savings accounts. But, you know, I think under Obama's plan, it would be, and under what Hillary had talked about when she was running, it'll be very, very hard for health savings accounts to survive, because if you offer a high deductible plan, you know, the government's saying a plan has to be approved by the government, and it's going to have all these mandates, so it'll be impossible to offer a high deductible plan.
Why isn't anybody talking about the cost of care, though? I mean, this whole debate's about health insurance, which is absolutely nuts.
I know.
Nothing to do with the cost, the underlying cost of it, which is care.
And we can reduce costs, as I've just pointed out, but no, because before the August 7th recess, the president realized that he wasn't getting anywhere with talking about health care reform, so he started talking about health insurance reform, and so the whole debate moved to health insurance reform. Yes?
Can I just make a couple comments? I don't know if I'm just limited to one, but I'm making that comment, one, as a providing physician. I'm a urologist in town. Two, I'm also involved in a malpractice insurance company. So regarding healthcare insurance companies, I mean, can you discuss, don't you think that some of their CEOs and upper brass are just paid exorbitantly, and that they sort of had their way with us? I know you said that Anthem is losing money right now in California, and I understand, and it makes sense. But don't you think that they've had their ways with us for the last 15 years, and that some of their upper brass are just paid way too much? I know that with us as providers, they've been bullying us around for the last 10 to 15 years. I mean, I remember when I came here in '91 and medicine used to be fun. And now you don't know if you're going to get knocked off their panel one day. And with that said, I'm not, you know, getting too far into this. I think one of the solutions they can do is get rid of these so-called in and out of network providers. You know, you can go shopping, like you said before, anywhere you want, get your gas tank filled anywhere you want, you pay cash, you get what you want. But you should have the ability to see any provider, whether it's here or at UCLA or Cleveland Clinic,
right.
And that insurance company has to pay the same amount, the deductibles have to be the same, and the co-insurance percentages should be the same. And if you have the ability to travel out of state and you want to pay that extra dollar, you can. Right now, these rules are so prohibitive, every I that's dotted, every T that's crossed is in their favor. So I think that it's so restrictive both for the providers and the patients. I listen to this every day, and I'm sure you've heard it, and some of the members in this audience. We're not only providers in different industries, but we're also patients, and we also have families, and we also may provide insurance to our employees. And I just deal with it every day. Every patient has an issue. And these companies have had their ways with us for the last 15 years, and I hold them mostly responsible for creating the mess that we're in today. And that's just on the insurance side, and I'm not going to keep going on my soapbox, but I think that that would be a good place to start. They could look at 4 or 5 of these contracts and go through them page by page, and it'd be clearly evident where the problem lies.
Well, I don't know whether, a think tank, and I know what I'm paid. I'm not paid what Angela Braley's paid at WellPoint. But one thing I would say is that, boards of directors approve the amount of money that is paid to CEOs, and, they have their reasons for paying those amounts of money, and it's not up to, I don't think, the public to tell a private company what someone should be paid or not. If I want to say, I think that the Secretary of HHS is paid too much, I can say that because I'm paying her salary through my taxes. But I think also, if you look at the return on investment from insurance companies, it's sort of 2.5% to 3%. It's much lower than the percentage return on investment that, say, the Microsoft makes or some other companies. So you can't just say, Kathleen Sebelius said the other day, well, Angela Braley, you made $2.3 billion without any concept of what the return on investment was. The fact that they had sold off a company and got money for that. I mean, there's just so much information that's not out there, and I think that but by moving to patient-centered solutions, by changing the tax code, by getting states to reduce mandates, if we had a competitive market in insurance, their prices would be lower because that's how competition works. Look at LASIK surgery. When it started, look what it costs. It doesn't come under an insurance plan. The prices come down. Milton Friedman used to say, when I first went out to buy my first microwave, it cost like $1,000. Now you can get a microwave for $50. When the market works, prices usually come down. It hasn't worked that way because we don't really have a properly functioning market in health insurance.
One more, I guess.
All of this is what we've been talking about, all these little specifics on healthcare. And I'm kind of surprised that I don't believe that you've used the one word in your entire remarks this afternoon. But these are all problems of a social solution to any type of issue. Whether you're talking about higher costs, government involvement, etc., doesn't that all boil down to the social solution to a problem? And is there any issue that can be solved by a social solution?
Well, I mean, as I said in the very beginning, and I say all the time, is that I think Obama and Reid and Pelosi, they believe that government can run our lives better than we can run them ourselves. And so it's part of their broad strategy. It doesn't matter whether it's healthcare, whether it's where your children go to public school, whether they're in a pre-K mandated program, whether there's how many emissions a company can, in terms of gas emissions. It's all about a broad philosophical difference about the way American society is structured. And I think, Bill used to say the proper role of government is to provide security for our people, and beyond that, the market can usually solve most problems. But I believe that the president is really, moving America down the line to a type of European democratic socialist country, because he's always apologizing for America rather than saying we are the greatest, and people come from all over the world. I mean, you came, I came, many of us came to live and seek a better life and things. So, but he's apologizing for the way we run our lives, and I think it's part of his philosophy.
Jeff, I saw your hand. Let's do one more. You got that?
Well, thank you very much.